what is my role in the next generation of scientists? Like, what am I producing? Like, what am I contributing to that generation looking like? Because whatever we're creating needs to be created for the people who it's going to serve.
Hello and welcome to our Buzz in Behavioral Medicine podcast series. Today we'll be talking with Dr. Sherry Pagoto. Dr. Pagoto is a first-generation college student who has had a fascinating journey through her career. With some bumps and turns along the way, her career has nevertheless skyrocketed. She was president of FSBM from 2018 to 2019. Currently, she's a professor at the University of Connecticut, where she is pushing the envelope by advancing the use of social media in behavioral medicine. You're really going to enjoy this podcast, learning more about her work and her journey. Thank you, Dr. Pagoto, for joining us today. It's great to be able to talk with you a little bit about your work. And this podcast is really about trying to learn more about the person behind the science. So we're very excited to talk with you today. So I read from your CV that you went to Auckland University in Michigan. Did you grow up in that area?
Yeah. So thanks for having me, first of all. So I grew up just outside of Detroit in Michigan. And I don't know, for some reason, I just found human behavior very interesting. Whenever I would see TV or movies about mental illness, I just found it to be very intriguing to me. And I thought, I want to learn more about that. And I couldn't wait for high school because there was a psychology class, and that was my first psychology class. And I loved it as much as I thought I was going to love it. And so I was eager to be a psych major. My family didn't have a lot of money, so I wasn't able to kind of go away to school. So I had like two choices of schools, either Wayne State University or Oakland University. And we lived a little bit closer to Oakland, and I had a really crappy car. So really what made my choice was like, what school can I get to without having to worry too much about like my car breaking down, which it did on different occasions. So that kind of made it a little bit of a no-brainer. But I had a great undergraduate experience being a commuter and a psych major, although I will say I almost switched out of psych halfway through and decided to do pre-med major. I considered it. I filled out the form. I was about to bail on psychology, but I had a professor who kind of lured me back into psychology, and eventually I discovered health psychology, which was a merging of my interests of psychology and health, because I was like, pre-med, psychology, which do I want to go?
What did that psychologist tell you early on that made you feel like, okay, this is the path for me?
So some of my undergrad classes did not seem very science-based to me. And so I was kind of fading a little bit. I felt like psychology should be more empirical, like even as a young person. And with this particular professor, unfortunately, he's deceased, but he is very, very influential. He taught from a very behavioral perspective. So he's definitely kind of a card-carrying behavior analyst, behavioral psychology. We talked about Skinner all the time. And so it introduced to me this area of psychology that was very scientific, and that made the difference for me. I was like, okay, I'm staying, this is what I want to do. And he was the one who kind of helped me figure out graduate school. My parents didn't go to undergrad or graduate school, so I was like, I don't know, how do you get into graduate school? Like, what does that entail? I have no idea. Okay. And he was the first person to take me to a conference and like learn what conferences were and what goes on at conferences. And so I felt like that was a very formative mentoring experience. And to this day, I find mentoring to be one of my favorite parts of the job. And I think it is because along the way, I've had some mentors that without them, I don't know that this is where I would be, because I feel like, especially early on, I really had no idea what I was doing.
Right. No, that's so important. I mean, just to have that person at a critical point in your career trajectory. You could have gone to pre-med, probably made a huge difference there too. But you ended up going towards behavioral medicine and psychology. I'm familiar with, not knowing what to do in terms of getting into graduate school. I kind of had the same experience too, but tell us a little bit about how you made that transition to Western Michigan University. Did you apply to other places? Were you thinking about, at that point, clinical psychology or health psychology?
Yeah, great question. So I definitely wanted to go clinical psych. And so the first year that I applied, I did apply to different programs. I got into zero of them. So go me. Um, but again, like I didn't know what I was doing. I wouldn't have, hired myself either. But I did get into a master's program at Western. And so the significance of Western Michigan University is that it really is like a mecca for behavior analysis. And that was really where my heart was. My undergraduate mentor literally drove me there to introduce me to the faculty there because he's like, I think you would like this graduate program. And they had a master's program in behavior analysis and a clinical psych program. I did not get into the clinical psych program there or anywhere at first, but I did get into the master's behavior analysis program, which for me felt like a victory. So I moved across the state to start that program, and I worked with a faculty member there who had students both in clinical and in behavior analysis. And so once we kind of got to know each other and working together, he was like, I know clinical psychology was the where you wanted to go. Why don't you apply for this coming year? And I thought, oh, that's a good sign. He's asking me to apply and I want to get in, so I'm going to do it. And so sure enough, I transitioned to the clinical psych program in my second year. So I didn't really lose any time. It was a good experience to, learn the process. And again, it was a strong mentor who helped me get to where I wanted to go when I didn't really know how to get there on my own. And so, yeah, I feel like that's kind of been a theme.
It sounds like you've had some people that saw something in you that they wanted to, make sure that you were on the right path to doing what you wanted to do, really. So, but I also read that, in your CV that you are involved with the clinical psychology newsletter. And so you must have been really heavily involved as a graduate student and that probably wasn't tweeting back then, but at that point it was it a actual electronic? Did it go out on Pine Mail or the
Yeah, and this is going to show my age. There was no
sorry,
Twitter
it's me
back
too.
then.
It's me too.
Yeah. We didn't really have social media back then. It was like in the 90s. So yeah, long ago. But so yeah, I decided to run for president of our clinical psychology association with a small group of our program, and then and we had a newsletter. And I think what attracted me to that, like being the editor of the newsletter, was kind of the early signs of wanting to like communicate in different ways that were like not necessarily just like publish manuscripts and things like that. I like the idea of writing and being able to kind of communicate what's going on in the program that we had. And so I think that was like the first example, the little glimmer of, things to come in terms of my wanting to kind of communicate to other audiences as opposed to just scientific communication. Well, like scientific manuscripts and things like that.
Yeah, and also being the president of organization. So we could talk about that in a little bit. But so that's great. I mean, it sounds like you were really involved early on in your career. You liked the fact that you could communicate about the science in a different platform than the traditional platform that we are supposed to communicate our science to, I guess. But there's so many ways to make an impact beyond that. So tell us a little bit about after you completed your training there, you went on to do your internship, and how did that process unfold for you in terms of getting involved in your internship? And I know you had done some work with children and families, and then I think you also did an internship more in adult. Were you more interested in just health psychology that got you interested in the internship that you went into?
Yeah. So when internship came around, so I'll also say when I applied for internships, I got my fourth choice. So I just kind of wanted out there, like, you don't always get your first choice on things. And it doesn't necessarily mean things aren't going to go your way. But it all worked out because I got a fantastic internship training experience. I wouldn't change a thing about it. I worked at on the West Side. It used to be called the West Side VA in Chicago. It has a new name now, but and so while I was in clinical training in graduate school, I did do a lot of work in community mental health. One thing I loved about my graduate program is that we got very well-rounded, strong clinical training in all types of different populations. In fact, I didn't really get very much health psychology training at all, which is one reason I was applying for health psychology internships. I was like, okay, I'm getting like a lot of great training in mental illness and, community mental health kind of stuff. Now I want to really sort of get some health psychology training. And so this particular VA, many VAs have health psychology tracks. And so that's what I was really after. And definitely got a great health psychology experience there. I couldn't recommend working in VAs anymore because it's just such a great, all like well-rounded experience for clinical training. And so I feel like I learned a lot working in a VA. It was great to work in a system that is kind of a universal healthcare system, like
Right.
within its own right, and like the benefits of that. I learned about psychopathology, trauma, comorbidities. I became very passionate about mental health and physical comorbidities. So, kind of within that health psychology space, of how psychological comorbidities on top of a physical or medical condition can really complicate treatment, and they have to be considered as a whole. You can't really like separate them and be like, okay, you have diabetes and you have depression, let's treat those separately, because they become very intertwined, and how you tackle your diabetes is going to be affected by your depression, and so on and so forth. So um, during my clinical training, those are the things that I was getting really excited about, is this idea of how do we address comorbidities? Because when you look at the clinical trials literature, it treats people like they only have one problem, and that's like not the real world. And so I was seeing kind of this gap between the real world and what you're seeing coming through in the clinic, and the VA especially, so many comorbidities. Every case was so complex and interesting, and so it wasn't just so simple as like, oh, a clinical trial says this if someone has an anxiety disorder. It's like, well, what if they have an anxiety disorder and substance abuse, a trauma history, diabetes that's uncontrolled, and all this other stuff? Then what do we do? So those were the kinds of cases that I found to be really fascinating, and kind of wanted to make an impact on topics along those lines.
And then, and then what happened? What happened next? You stayed at UIC, is that right?
So yeah, so I'm in Chicago. I'm on my internship, and which obviously is like a full-time clinical experience. And like I said, it was sort of really bringing to light for me sort of the shortcomings of research in terms of helping me as a clinician. And so I thought for my postdoc, I would like to do something more research intensive, build out my research skills. I felt like I was really solid as a clinician, but not so solid as a researcher. And so I thought, this is going to be my last chance to get an intensive research training experience. And I kind of wanted to stay local. I had just moved to Chicago, totally fell in love with the city. I'm
Great.
like, I don't want to leave yet. And so I saw a postdoctoral ad put out by Bonnie Spring at UIC, and it was very much in the health psych space. And I was like, oh, well, now this is right down the street, isn't it? So this could be very interesting. And she was doing a lot of clinical trials looking at comorbidities. So I was like, boom, this is what I want. So she's doing a lot of work on like smoking cessation with people with depression, emotional eating and obesity. And so kind of the two areas that she was working on at the time, and still to some extent now, had to do with smoking and obesity, but looking at kind of negative affect as a factor in sort of fueling these types of behaviors, whether it's unhealthy eating or tobacco use. And so I was like, this is the kind of thing I wanted to like dig into. And I like that she was designing clinical trials, like kind of getting into that messiness of the comorbidities. So it was like, this is so for me. So I was like, I want this position so badly. And so I was lucky enough to get it. And so I became a project coordinator for NIH funded clinical trials, which was really throwing me in the deep end. As someone who I was like, I'm a clinician, like masquerading as like I'm a researcher, like 'cause I don't know what I'm doing. Um, but it was a great sort of being thrown in the deep end experience of how to run a clinical trial. And then Bonnie also allowed us postdocs to have some protected time to work on a K award. And I really felt like that was a good thing for me because I felt very behind. When I stepped into my postdoc, I had a total of 0 publications. So, yay, so productive. And because I was really, diving into the clinical side and seeing that as my identity. And so I kind of went into postdoc with a huge kind of inferiority complex and so I wanted to, work on my research credit. And I could see that a K award might be a great way to do that by having that protected time to build out my program of research. Now that I really felt like I know what I want to do. I want to do research. I'm really interested in comorbidities, and I'm going to need to build these skills and have some time to like get that publication record going and, establish my program of research.
And then you wrote your K award and you got it, right? I mean, that
I
was the other
did
part
get
of that story.
it.
Yeah. So
Yeah, miraculously. I got it. And so
that
I
must
was
have been
so
so.
excited.
You must have been so excited for that.
It's funny. I remember the moment I got my score. I looked at it and I was like, wow. And then I realized I don't know what that number means. And so like I called up Bonnie and I was like, I got a score. And she's like, well, what is it? And I told her and she was like, you're funded. And I was like, I am? Yay. Like I was happy, but I wasn't sure why. That's how green I was. I was like, I don't know what the score means. But so yeah, it's like it feels like it was an absolute miracle that I got that funded on the first try. But I got a lot of help from her. And Bonnie also did a great job of introducing me to people at NIH. I remember at SBM, she was like, let's take Peter Kaufman to dinner. He was at NHLBI at the time. And I was like, oh my God, I don't know if I can like sit and have dinner with these people. Like, I'm going to say something stupid or make a fool of myself. She's like, no, you tell them about your K idea. And I was like, oh my God. So I did. And to this day, like I love Peter Kaufman. Every time I see him, I'm like, hi. And I did the RCT camp that he was very involved in for so many years and stuff. And so those connections, I think, were really important in terms of helping me think through my research ideas and making sure that they were like fundable ideas and how to shape them. So I can't emphasize enough to kind of junior people around finding the mentors who are doing what you would like to do and learning from them and that's really, I mean, I guess so far it's like becoming a theme in this conversation, but it's so true, I think.
I remember those times too of being nervous around these very senior members of of our
nervous.
field, and thinking, what am I supposed to say? And it, looking at it now from a different perspective, I'm sure you have a different perspective on that. Like now being sort of one of those senior members in the field, and what advice would you give a junior member?
To not be afraid to. I mean, I felt, especially when I was younger, I definitely had a lot of social anxiety, public speaking anxiety. Like I wanted to throw up if I ever had to give a talk. Or I'd like cry the night before. Oh, I would cry the night before and then I just like pull myself together and do it, but it was awful. And so I always was afraid of making a fool of myself. The best way to overcome that for me was just doing it anyway and finding out that 99% of the time you're probably not making a fool of yourself. And even if you did make a fool of yourself, like no one's paying enough attention to even know that it occurred. So I would say definitely approach people that you're interested in having as a mentor. And honestly, when people do that, like I'm flattered if someone comes
Mm-hmm.
up, if I'm walking around SBM at the posters and someone's like, oh, hey, hi, I just wanted to meet you and let you know, blah, blah, blah. I'm like, oh my God, makes my day. I had no idea that was like the experience of mentors. Because in my mind, I'm like, I'm bothering them. They want nothing to do with me. I'm going to say something stupid. I'm going to reveal how little I know. Um, yeah. And so all of the things in my head were so wrong. And so I would just encourage people like to go for it. You don't have to, have some amazing idea to share. You can just be like, hi, I've read your work. I'm really interested in it and I wanted to meet you. And like the conversation will probably go from there. You don't have to have like this big thing of like, here's my Nobel Prize winning idea I wanted to tell you about. It doesn't have to be like that.
Well, and I think one thing that you did share with our audience today too was that, you know, there were failures along the way. Oftentimes we see our mentors as having no failures or being all put together and being so expert at things. But you shared with us today that, things kind of evolved and there were some failures. There were some definitely lots of successes, but also some setbacks along the way. And I think it's good for our mentees and our trainees to hear that, it's not just about success. It's about learning how to, have failure and to deal with those
Yeah, and I
failures.
think academia is a great place to sort of learn how to be sort of failure tolerant because we're failing all the time. Like, think of your grant applications that get turned down, your manuscripts that get rejected. It's kind of part of the process. I understand that now. I didn't before. I thought, like, if my grant got rejected, I remember putting in like my second grant ever and thinking like I got lucky the first time, it's not going to happen again. Um, and so like every failure, like if it didn't get funded or it got rejected, I felt like, see, it's over. I got lucky and now it's over. And then after a while, I'd be like, that's such a silly way. That's like such black and white thinking. And and so I would keep trying and be like, oh, and then I would see people like Bonnie or others, like sometimes her stuff didn't get funded. I'm like, well, I know she's smart for a fact, and some of her stuff doesn't get funded, or I know that person's smart for a fact, and then some of their stuff doesn't get funded. Then I get on study section, I'd be like, well, I know all of the people who are PIs of these grants are smart for a fact, and they're not all getting funded. I was like, oh, okay. It's everybody. That's cool. I don't feel so bad. So,
A good club to
yeah,
belong
like
to,
we're
right?
all
Yeah.
failing hard. But we're, and there's successes in there too. But not all of my ideas are going to be brilliant, right? Like, and so I look back at grants that I wrote too, and then I'm like, at the time, I was kind of pissed that they didn't get funded. But then I look back and I'll be like, the reviewers were right. Like that wasn't ready. It wasn't ready. I was like, my heart was set on it, and my ego was set on it, but like it wasn't ready. I can see it now from a distance, but at the time I was too close to it. So like I think that's important too, is to like you you got a lot of ideas. They're not all going to be winners, and you start to shape your program by kind of what's hitting and what's not. And we can criticize the reviewers and that sort of thing. And sometimes they say crazy things, and you're just like, oh my goodness. Um, but but you learn from that process too, and I think it's part of what makes you a better scientist. So I always want to tell my students that of like, it's okay, like it like your grant not getting funded like has no it is not speaking to your ability to do research whatsoever. It just means you're playing the game.
I think it's fair to say that you are a social media influencer of sorts. You're very active on social media. Tell our audience a little bit about why scientists need to be involved in social media and how we should be using it more effectively. It's kind of controversial now with the changeover to X and thinking about what are the next platforms we're going to use. And so, tell us about your thinking about this and how you started thinking this is an important platform to really engage with.
So, lots of reasons I think that social media is important for us to really be understanding, using, as behavioral medicine scientists and practitioners. Lots of reasons. So, first, we have now entire generations of social media natives. So, I have a 16-year-old daughter who's about to turn 16. she grew up on social media. This is how she builds social networks, how she connects and communicates. Her generation, this is how they interact with each other. And for that reason, we need to really start thinking about conceptual models that help us understand this new communication landscape. So one thing that kind of frustrates me is like all the hand waving and like moral panic about social media. In some ways, it's counterproductive to the extent that that is dominating the narrative. And so I feel passionately about like, let's, shift the narrative a bit to kind of talking about how we can better understand how young people of all ages are using social media, what they're getting out of it,
Right.
and how we can kind of change the way we think about social and interpersonal lives as we're moving forward. And all generations will end up being social media native. So it's not going away. So we have no choice but to try to understand it, or we're going to start failing our different generations in terms of being able to best address their needs from a health perspective. So another reason I think to learn about and use social media is because patients are. So there are myriad patient communities on social media platforms. Let's just take Facebook as an example. Enormous ecosystem of patient communities that were started by patients, for patients. It's proliferated. You name a condition, the rarest of conditions, the most common of conditions. There are tens, if not hundreds, sometimes thousands of Facebook groups with patients who want to connect with each other. So I've started these types of communities through my research, and I'm also a member of some of these communities as a patient myself. Patients want to learn from each other. They crowdsource knowledge in these communities. They connect each other to resources. They provide each other a type of support that's different and unique from the kind of support that their friends and family who aren't on the same journey can provide. And all of this exists outside of the healthcare system. So one thing I'm very passionate about is like, how do we join these worlds of patients trying to help themselves manage their disease on their own, sharing resources, becoming educated about their condition and the healthcare system. Because if you talk to patients who are in these communities, they'll say, this community was as important, if not more, than my healthcare team. And I totally believe it as a member of these communities. And there's just so many examples of how patients are benefiting from it. And so when we think about community, when we think about community-based participatory research, we think about brick and mortar communities, the community center downtown, community organizations, but community is proliferating online. So how do we create partnerships with those communities? They're quite large, and they're global, many of them. People connecting, across the world about diabetes, about cancer, et cetera. So that's something that I'm really interested in, is thinking about ways that we can take what we're producing in our behavioral medicine research and bringing it to those very intact, very engaged communities that are online, and kind of thinking outside of the box of CBPR to this online world that exists. So my third reason that I think social media is really important is because it's what we can use for science communication. So during the pandemic, we saw some amazing science communication, and we saw some horrible misinformation, and it was kind of all swirling around. Like, my daily habit during the pandemic was to go to certain like virologists, epidemiologists, physicians, infectious disease people on Twitter to find out, what do I need to know from these people to keep myself and my family healthy. Like, they were like a lifeline for me. They don't have any idea about this. Like, I was like,
Thank you, Fauci.
yeah, Fauci and others. And, even just like university professors who like, this is their expertise. And they kind of became Twitter famous for talking about it. It was so great that they were there. But the thing that was, I guess, concerning to me was that if we had done a better job before the pandemic of coaching and teaching scientists on how to be communicators, maybe the the ratio of good science to garbage would have been tipped towards the good science on social media. We did not flood the zone. Misinformation flooded the zone, as it so often does. And so I hope it's a lesson learned. And I did see a lot of people who, weren't necessarily science communicating, kind of getting out there and doing their part with, whatever they were passionate about. And so that was encouraging, but like we need more of it so that when we do have public health crises like this, that the public is listening to what we have to say. Because there's a bunch of people out there who are really good at getting the public's attention, and they're not sending messages that we want to be sent out, but they're just good at marketing themselves. They're good at dissemination. And unfortunately, they're better than most of us at those things.
So you've been doing some work in digital mobile health for some time. So you've done a little bit of work in obesity and skin cancer. And what is it? What are some of the things that you're most proud about in terms of the work that you've been doing in that space?
Yeah, so I dabble in like some different topics, but I do see them sort of through the same lens, and look at similar types of solutions for them. So, in terms of whether I'm doing cancer prevention or obesity management, the thing that I've always been interested in, and kind of goes back to something I was talking about at the beginning, was how our emotional experiences affect our choices in terms of health behavior. And so when I originally got into skin cancer prevention, it was focused on kind of why people tan. What is that about? And one of the interesting things that I learned was that people do it for mood management. And at the time, I was doing a lot of work in with eating behavior and seeing the same parallels, and then with the smoking work I was doing. And so it was all kind of coming together of like, we do unhealthy things to manage our moods, and so we need solutions to that. Obviously teaching people coping skills that are healthy, when it comes to managing their moods, because when they don't have healthy coping skills, they're going to gravitate towards some unhealthy choices. Some people might spend time in the tanning bed. Other people might be eating junk food. Other people might be vaping, or, or drinking all kinds of different unhealthy behaviors. So that's always been like the thread, is thinking about how we cope and how the ways that we cope could influence our health. So there is kind of like that common thread through everything. I got into the technology stuff first kind of through my interest in social media. And the reason I got into that was I was working at UMass Medical School, and some of my time was establishing a diabetes prevention program in their weight center, and also being a clinician there while I was doing my K award and developing my program of research. And I always kind of felt like there was more I wanted to say to my patients who were in my groups. And so I started blogging. I was like, I'm going to develop a blog, and then I'll, send them posts, that elaborate further on concepts that we talked about in group. And as I was blogging, I thought, well, I'm creating all this content. I'd love to, get it out there to more than just like our patients. And so that's when I originally got on Twitter, is because I was blogging and I wanted to create an audience for my blog. Because I was also thinking of like, well, maybe I would like leverage this blog into a book or something like that. So I got on Twitter and I started looking around for people who might be interested in the content that I was creating. And I discovered that, wow, there are a lot of people on Twitter using it to tweet about their weight loss journey, to tweet about their diabetes. And I've discovered there's all these communities with hashtags and chats. And I was like, wow, who knew all this existed? Like, I was like, it was totally new to me. But it was game changing for me, because I was like, this is fascinating how people are using this. I want to study this. If they're using these tools for their health, we need to be using these tools for their health. We can't just let this sort of, run away from us. So I started to do some studies to kind of find out what people were getting out of that. Like, why would you go on Twitter and tweet about your weight loss with a bunch of strangers? When you could get weight stigma and, bullied and all of this stuff. And what we were finding is that people were saying, no, we don't get that. I have to block those people. They're gone like instantly. And they were able to like curate a community for themselves that was helping them reach their goals. And so I did a survey of these people, and like the average weight loss that they were talking about of all the people I was surveying was like pretty high compared to even like a weight loss trial. And I was like, these people are onto something.
Wow,
They're
that's
like getting really active and losing all of this weight. Like, what am I missing? Because I've been studying this. And so I wanted to learn from the people doing this. And that's kind of what got me down that path. And so, to make a long story short, in the last several years, we've been developing a weight loss program based on the diabetes prevention program, but so much more that can be completely delivered in a private Facebook group.
okay.
So the entire program is in the group. So it's not like the group is an adjunct or just where people socialize. Like we developed a feed that walks them through the program. They follow it, set goals, do problem solving, like all the behavioral strategies are there. We add fun, like gamification kind of things. And I'm excited to say that in February 2024, we're going to be launching a version that's available to the public on a subscription basis so people can participate outside of the context of research. And so I'm very excited because we're finally going to implement it in the real world and allow people to participate and see kind of where it goes by offering it in that sort of context. And it'll also produce lots of great data that we can use to further kind of optimize the program at a much larger level. So in our trials, we might recruit 200 or so people, but if we create this program and have access to the data, we can get much larger data to help us really understand a lot more about weight loss, like the process that people go through, what they're sharing in the group, what sort of content really engages them, and how we can better engage them through some of the insights that we learn. So super excited about that.
That is exciting. Yes, it's very exciting, Sherry. So yeah, you'll be able. It's sort of like you're scaling your earlier evidence-based approaches. Really, really exciting and fascinating because you can learn so much more from 5,000 individuals than you can about 200. The variance, starts to kind of come together, and you get the story a lot better. So I asked one of your colleagues about you, and I said, tell me a little bit about Dr. Pagoto. She's saying you are one of the most collaborative persons in the field. So, what is your philosophy about collaboration? Why do you keep saying yes to everything?
Well, I don't say yes to everything.
Okay. You've
And
learned
I've
to
gotten
say
a lot
no.
better at saying no.
Good.
But I think collaboration is an essential requirement to doing this work, especially if you're in the digital health space. I'm a psychologist. I have so many blind spots doing this type of work. I'm not an engineer. I'm not a computer scientist. I'm not a biostatistician. I do a lot of public health type stuff. I'm not a public health person. Like I'm not a card carrying public health trained person. I do a lot in health communications. Don't have that training background. So I feel like I think the way to do the strongest work is to recognize what your blind spots are and build a team that doesn't have your blind spot. So if I built a team of psychologists who are white females, the team is going to have all the blind spots that I have. And so we're not going to be very creative, more so than I would be by myself. In fact, I used to teach a class on team science, and one of the things that I always remember from teaching it is like the importance of teams, but even more importantly, diversity of teams. So when it comes to expertise, when it comes to gender, race, background, all characteristics, the more diverse and well-rounded your team is, the more creative and productive it's going to be, because you're going to be eliminating those blind spots that, trust me, your study section is going to point out, your manuscript reviewers are going to point out. And I feel like that's been part of my experience too, is like when you get criticisms, whether it's study section or manuscript reviewers, it shows you what your blind spots are. right away. You'll be like, oh, they're right. I wasn't entirely sure how to describe that model, and they noticed. And so I need someone who's like a little stronger on that than I am. Um, so yeah, I think it's essential to doing research. And that being said, you want to find the right team members and the ones that are, work well with you and compatible with your work style and that sort of thing. So I don't think collaboration has to mean like saying yes to every time you're invited to something. Um, but so you want to be judicious in, the teams that you join and the people that you bring onto your teams. But I think it would be impossible to do without a high functioning team.
Yeah, and it's I think it makes the science more engaging, more fun to have that diversity of perspectives solving a problem, right? It's just that.
Absolutely. And when I bring in students and postdocs, I'm actually looking for someone who is different than I am. They're bringing something, some aspect, ideally more than one, that is something I don't have. So that I'm going to learn from them. So it's like selfish, I guess. I'm going to learn from them. And obviously they're going to learn from me. I have all kinds of stuff I'm like excited to teach them. And I think that helps too. So my trainees, I always like to continue to work with. And I have trainees that, from years and years ago, we still collaborate on things. So I really kind of see my trainees as like my future lifelong collaborators, hopefully.
Right.
And so
They could be
I
your boss one day, right?
heck yeah, hopefully, yeah, they're going to hire me and pay me a lot.
So tell us, how do you recharge? I know you plank, and we could do some planks right now, but we'll
I
be able to
do.
see us on the floor there. But how do you recharge? How do you maintain balance?
So, two things. One thing is I get up every morning and I go outside and I run. Today was beautiful because it was snowing, so I love to like run in the snow. Um, and that I feel like I would say that pre-charges me for the day, and that like intellectually, emotionally, and physically, like I feel like I'm ready to like be in the zone. So that's really important to me is my physical activity. And I do planks too, 3 days a week.
Okay.
And the other thing I would say is my daughter. I mentioned her already a couple times, and she's my recharge too. Whether we're binge watching the Gilmore Girls, which we love, or discussing like the political topic that they discussed in government class. She'll bring it home and be like, Mom, you're not going to believe like what they were talking about. And what do you think about this? That's so fun to me. She's a volleyball player. So going to her tournaments and seeing her play is amazing. And just like all the fun things that we do together. Yeah, she's turning 16 next week. So time is ticking before I'm an empty nester, and she's my favorite person in the whole world. So every minute I get with her as the time is ticking away, I'm going to take no
Take
matter what we're doing.
advantage of it, right? They grow up
Uh,
so fast, and family is so important. And when everything's going well, that center of family is so important. You talked a little bit earlier about being a first generation college student and first generation graduate student in your family. That perspective of being the first and having that perspective that maybe others didn't have. Has that shaped your ideas about diversity and inclusion and collaboration in your work?
Definitely. So one of the things that I think about a lot is there are a bunch of brilliant kids out there, young people who just didn't have like the right mentorship or opportunities. We need to find them. Like they're just like a bunch of people with creative ideas and the ability to do all of this. And how do we find them and bring them in? As opposed to just like going through pipelines and things like that, which can further um, divides and like limit opportunities to certain people. So it's exciting to find those diamonds in the rough and help bring them up. And so I feel like a commitment to doing that. And I think like as a first generation person, you don't have like the kind of assistance that I can give my daughter now that, she has me and I can kind of usher her in, and that's going to be such a great thing for her. But I didn't have that. And I think it led to like some clunkiness in the start. And thanks to mentors, I was able to make my way through. And so I do feel that commitment to pay it forward too. And that being said, I also feel like another reason for it is back to the blind spots things that I talked about. I am continually learning from my mentees who are from different backgrounds from me. And that's, I think, making me a better scientist in ways that I wouldn't know because they were blind spots. And so those things together, I think, are why I think that's so important to do. And I would encourage other people to think that way as well. And the further I get in my career too, I also think about like, what is my role in the next generation of scientists? Like, what am I producing? Like, what am I contributing to that generation looking like? Because whatever we're creating needs to be created for the people who it's going to serve. And so the creators must look like and have the different characteristics of the people being served. And so, yeah, like as your career goes forward, you do start thinking more about those things and so I have a mid-career K award right now, which allows me to protect some time for mentorship. And so that's something that I've thought a lot about is like, am I contributing to a diverse next generation? Or am I contributing to a generation that is going to just reflect the same blind spots that I have? And as a female, I can see more clearly how blind spots have affected like women's health. And that's true of a lot of groups where the blind spots are such that there are areas of health that have not been addressed. And so I certainly don't want to contribute to that. And if anything, I want to remedy that. And so yeah, it's something that I do think about quite a bit.
It's like we have a responsibility to pay it forward, as you mentioned earlier, too, to kind of say, we've benefited from good mentorship, and maybe didn't come. The path was not a linear path. It kind of squiggled around a little bit, but we had those mentors in our careers that helped us, and that's so important, really important to have that. Well, this has been really fun. I've enjoyed talking with you, Dr. Pagoto. This has been exciting. Another one of your colleagues said you sing a mean Bohemian Rhapsody. So do you want to sing us out with Bohemian Rhapsody, or should we wait for the karaoke club for that?
I'm going to save that for SBM, but I am happy to do a Bohemian Rhapsody karaoke with anyone who would like to join me at SBM. So it's a fun karaoke song.
All right.
I'm nominating you, Bernard.
I'm looking forward. No, you don't want to hear me sing. I don't think. But I'll be in the audience, cheering you on for sure. And that brings us to the end of another insightful episode of SBM's Buzz in Behavioral Medicine. A huge thanks to Dr. Pagoto for sharing her journey and her wisdom with us. Be sure to check out the show notes and links for Dr. Pagoto's articles and relevant SBM resources. As we reflect on our conversations and anticipate the future of behavioral medicine, remember, it's our collective drive, passion, and curiosity that will shape the course of the future of behavioral medicine. I'm Dr. Bernard Femler, reminding you that behavioral minds matter. Keep doing the good science you do and the science that does good. Remember to like, follow, subscribe to receive notifications.